Hi ladies, welcome to my Women's Health channel. I am Dr. Nonye Okoye, for those who don't know me, your favorite OBGYN specialist who is here to give you all of the information that you need so that you can make an informed choice about your health. I hope you're enjoying my Women's Health tips. If you've not subscribed to my YouTube channel, please quickly do. If you can do that to get all the content in Netflix, then you should get that about your women's health, because wellness is the new currency. So let's talk about an important aspect of our health. And I know you all are enjoying this perimenopausal and menopausal dialogue. So today we're going to talk about perimenopause, menopause, and the vaginal dialogue. Part 2. Our vagina is a temple. A lot of things happen in our vagina. So I am very sure you also want to know what happens to your vagina as you advance to perimenopause and menopause. Now, for those who never followed me on Instagram page, I said the other time that perimenopause usually precedes your years of menopause, about 10 years. So putting the average age of menopause in Nigeria to be 48 in most of the women you see. So that means that at around 38 years, you are likely perimenopausal. So if you now happen to be menopausal at 45 years, like we see in most of women coming to us, that probably means that around 35 years, you have been perimenopausal. Now, what's more important about this is how you can prepare yourself and get the knowledge that you need as you are advancing into menopause. So let's talk about what happens to our vagina. Not just our vagina, our external reproductive organ. So most of our organs down below, I mean your vulva, which is that lip covering the vagina itself, the clitoris, the glands around the vagina, the bladder, which stores your urine, the urethra. They love estrogen so much. By the way, this information I'm giving you is a general information. If you have any perimenopausal or menopausal health issue, it's recommended that you go and see your gynecologist, who is going to review you and give you an individualized care. And so, as I was saying, a lot of things happen to our organs as we advance to menopause. And I don't think it's something we should be worried about, because really, apart from human beings, there are other 3 mammals that are just able to live beyond their reproductive years. Meaning that all other mammals, apart from the whales, they are not able to live beyond their reproductive years. Meaning, once their ovaries are done, they don't survive, because the tissues go through a lot and can't survive the heat of living when the female hormones are not there. But unlike human beings like us, we are advanced mammals and we are able to thrive and also do well. And with the science-backed information, you can even do better as you advance to perimenopause and menopause. And I said earlier that our very important female hormone, which is our estrogen, it begins to drop down by the time we are perimenopausal, and finally it retires during menopause. So towards the time we are at 7 years of age, so we're getting to 40. At 40 years, we just have 1% of our eggs left, and at that point, our female hormones, estrogen, begins to go haywire. It just goes up, down. So during that period, when it's coming down, going up, coming down, as a woman, you could also encounter some changes, including vaginal changes that really occur during menopausal period. What happens to our vagina before menopause? Before perimenopause, our vagina is thick and it's supple, and it doesn't joke with estrogens, because estrogen does a lot to these organs. Number 1, estrogen causes increased blood supply to your vagina. So there is increased blood flow, and the vagina and the vulva and other organs around there, they are so healthy. With increased estrogen, there is increased, production of collagen. Collagen is also what sustains the vagina to be thick, to be stretchy, to be elastic, which happens when you are having sex and you enjoy the pleasure, because the vagina is a hollow tube that is stretchy, and you just keep enjoying your sexual pleasure when you're having sex, because it's just stretchy. Apart from that, the female estrogen also helps with our vaginal lubrication. The vaginal glands around the vagina, with the estrogen, it causes the production of fluid, causing our down below to be wet while we are having sex. What else does the female estrogen does to us? The estrogen also helps the vagina to be acidic because it causes the increased availability of what we call the lactobacilli, which are the good bacterial bugs that keeps our vagina healthy enough away from yeast infections. Apart from this, the estrogen also helps with the urinary system. By increasing the thickness of the labia, which is the lips around the vagina, it causes, the protection of the urethra from where you weave from. So you're likely not having recurrent urinary tract infections because the urethra is protected. Also, the bladder, which stores the urine, is also a friend to the estrogen because with the estrogen, it causes the bladder not to overreact as opposed to when you are menopausal. When we attain menopause, the reverse is the case. What I just mentioned, the opposite is the case because the estrogens are no more there, so the opposite happens. The vagina is no longer thick, it is thin, it is no longer supple, it is no longer elastic as it should be, it becomes shortened, increasing the chance of you having pain, tenderness during intercourse, and also the dryness because the glands are no longer producing the fluids as it should be produced during sex. Sex is more painful, especially when there is penetration towards the 6 o'clock position in your vagina. It could be so painful, and really, this is really bothersome. Now, how can we manage this? It's very simple. To end this video, I'm going to talk about the remedy just for the perimenopausal women. For the menopausal women, then that's going to be a talk for another day. Now, if you're perimenopausal, like I said, you're within the 10 years before the likely age of your menopause. That means you're likely going to have up and down spikes and low of your female estrogens. And as such, you could have intermittent vaginal dryness, and because you're losing estrogens, and this could be worsened with stress and other issues of life. So when you have ruled out the common causes of vaginal dryness, here is a simple tip of what you can use as a natural remedy to make the vagina soothing and well lubricated even before you get wet. There are so many things to use, but I recommend use of coconut oil. Coconut oil is a natural remedy that is soothing enough, serves as a lubricant. It also has antimicrobial properties, and I recommend that for my clients. And so far, I think I've gotten only positive responses. And it's really important that you also review with your gynecologist before you try any of these products. Now, when you use a coconut oil, use a refined coconut oil that is cold pressed, meaning that it has, all the antioxidant properties, antimicrobial properties, fully, completely packaged without any interruption so that you can also enjoy its complete benefits. So it serves for different purposes. You can use it daily. It keeps your vagina healthy a bit because it has antimicrobial properties. It can serve as a soothing agent, helping you with vaginal dryness. It's also very helpful as a lubricant during sexual intercourse. So all you need to do is before sexual intercourse, because you have been applying this daily, right? Even when you're not having sex, it's important you just apply that to keep your vagina soothing enough. So before intercourse, you just wash your hands and then use the coconut oil and apply it in your vagina before your sexual exposure. And most of my patients, I think they do very well with coconut oil in its natural and its pure form. There is nothing wrong with you using that. It's not your fault. It's not your husband's fault. You are perimenopausal. It's just natural. It's just physiological. You need to explain to your husband, and he has to be patient enough while you're using the coconut oil before sex. I recommend use of only coconut oil. Some use coconut oil, aloe vera. I can't say about aloe vera in the vagina. I know of coconut oil because I'm here to give you all of the updated, scientifically backed up information. And so I hope you've learned something for today. The next conversation, we're going to talk about other things like lubes, like gels, and hormonal therapy to be applied down below for women who are menopausal, who do not even have estrogen to sustain their vagina healthy enough. Because the truth is, if you do not use a therapy like estrogen down below, what's going to happen? Your vagina is going to be thin, it's going to be dry, it's going to be inflamed, it's going to be sore, it's going to feel painful, it's not going to be healthy, you're going to lose a lot of good bacteria that sustains you down below. You're going to be at increased risk of having recurrent urinary tract infections, and we call that vulvovaginal atrophy or genitourinary problems, and that's going to increase when you advance, in menopause. So we need to find ways so that we could also enjoy our sexual life. And as much as enjoying your sexual life, that's not enough. You also need to find ways to make sure that your vulva and your vagina and your bladder and your urethra, they are all healthy as you attain perimenopause and menopause. If you enjoyed this, I hope you like, share, comments, tell me what you feel about this topic. The next conversation, we're going to have menopause and vaginal dialogue part 3, and then we can talk about women who are really menopausal. What can they really benefit apart from the lubes and the gels? So thank you for joining me once again.